The growing popularity of vegan diets has made its way into the world of oncology, where patients and survivors alike seek dietary strategies to prevent recurrence, improve quality of life, and support healing. The emphasis on whole plant foods, fiber, antioxidants, and low-saturated fat aligns well with many cancer prevention guidelines, and population-level studies often associate plant-based diets with reduced inflammation, lower cancer incidence, and better metabolic health. But beneath this promising surface lies a more complicated picture, one where nutritional adequacy, especially over the long term, demands careful planning. For individuals recovering from cancer or navigating survivorship, a vegan diet can be both protective and potentially problematic if not implemented with precision and awareness. The benefits of a well-structured vegan diet are substantial. High intake of fruits, vegetables, legumes, whole grains, nuts, and seeds offers a wide spectrum of phytochemicals that modulate oxidative stress, support immune surveillance, and may interfere with carcinogenesis. Diets rich in fiber also help regulate blood sugar, promote healthy gut microbiota, and reduce circulating estrogen levels, all factors implicated in the development or progression of certain cancers. Vegan diets are generally associated with lower body mass index, reduced insulin resistance, and better cardiovascular markers, which are critical for long-term survivorship. However, the shift to an entirely plant-based regimen is not without risks, particularly for cancer patients who may already face challenges with appetite, digestion, and nutrient absorption. Some key nutrients that are either absent or poorly absorbed in plant sources include vitamin B12, iron, zinc, iodine, calcium, and long-chain omega-3 fatty acids such as EPA and DHA. B12 deficiency is of particular concern. It is essential for DNA synthesis, red blood cell formation, and neurological function, and a deficiency can lead to irreversible nerve damage, fatigue, and cognitive decline if left unaddressed. Since B12 is found naturally only in animal products, supplementation is not optional but essential for anyone on a vegan diet, especially those recovering from the physiological stress of cancer therapy. Iron is another critical nutrient, especially for those who have experienced anemia as a side effect of chemotherapy or radiation. While plant-based sources of iron exist, they come in the non-heme form, which is less efficiently absorbed and more sensitive to inhibitors like phytates and polyphenol. This is further complicated by inflammation-induced changes in iron metabolism common in cancer patients, making it difficult to restore adequate levels through diet alone. Similar concerns apply to zinc, a mineral vital to immune function and tissue repair, and iodine, which supports thyroid health, especially important during periods of stress and recovery. Then there's the question of omega-3 fatty acids. EPA and DHA, found in fatty fish and algae, play key roles in resolving inflammation and supporting neurological health. While plant-based omega-3s, ALA from flax, chia, walnuts, are present in vegan diets, the body's conversion rate to EPA and DHA is inefficient and varies greatly between individuals. For cancer patients, especially those dealing with inflammation, brain fog, or cardiovascular complications, this inefficiency can leave a critical gap. Algae-based DHA/EPA supplements offer a solution, but many patients are unaware of their need. Compounding these risks is the reality that cancer patients often experience taste changes, early satiety, nausea, or digestive discomfort. These side effects can make it even harder to achieve nutrient density on a plant-based diet that already requires volume and variety to meet basic needs. A poorly planned vegan diet in this context can easily lead to unintended weight loss, protein insufficiency, and deficiencies that compromise immune function, delay wound healing, or increase fatigue, undermining the very goals of the diet in the first place. Personalization is essential. While some cancer survivors thrive on vegan diets, especially when supported by registered dietitians and supplement protocols, others may need more flexibility. This could include occasional inclusion of eggs, dairy, or seafood to meet nutritional targets, particularly during or shortly after treatment. In some cases, a plant-forward but not strictly vegan diet may offer a more practical balance between metabolic health and nutritional sufficiency, especially in older adults or those with gastrointestinal limitations. There is also the psychological and emotional component to consider. For some, a vegan diet provides a sense of control and empowerment in the face of an unpredictable disease. For others, it may become another source of stress, guilt, or disordered eating if pursued rigidly or without regard to the body's changing needs. In oncology, where individual variation is vast and nutrition must adapt to the evolving demands of treatment and recovery. Ideological purity should never come before clinical reality. Ultimately, a vegan diet in oncology can be both beneficial and risky. Its protective potential lies in its emphasis on whole foods and anti-inflammatory compounds, but its safety depends entirely on careful planning, regular monitoring, and supplementation where needed. Without that oversight, a diet intended to heal can gradually erode strength, immunity, and recovery. In cancer care, nutrition is not just about what to eat, but about what the body can use, and that requires more than good intentions. It requires precision.